Hey there, and welcome back. Thanks for joining us today at Boston Children's Answers Parentcast. Today we're talking about a topic near and dear to my heart, and that is caring for kids with medical complexity. These are kids that typically have multiple medical conditions and really a lot of healthcare needs for parents to manage. As always, let's start off with a question from our guest parent.
Hi, I'm Brian. My son has several medical conditions and sees many specialists. Who helps coordinate care for kids like mine?
Brian, that's a really great question. You're in luck. I have a dear colleague and an amazing expert in this field with us today, Dr. Jay Barry. Dr. Barry is actually Chief of Complex Care Services at Boston Children's Hospital. Thank you, Dr. Barry, for joining us today.
Thank you so much for having me.
Parents may not realize, how many kids fall into this group. Before we dive in, though, I wonder if you could share with us sort of how you got into this field.
Yes. So as a medical student, my first time ever setting foot in a children's hospital, and I started to see all these kids that had chronic conditions and lots of medications and durable medical equipment and supplies. And, I was not exposed to these children at all, growing up. And I sort of thought of pediatrics as, I go into your outpatient pediatrician for maybe a physical every year or getting your ear infection treated, something like that. Not to undermine that work, which is super, super important for general peds.
Absolutely.
But it just sort of opened up my eyes to this entire world of other kids out there that were enduring some pretty serious health problems, and seeing what the families were going through, caring for them, advocating for them, trying to get them the best care possible. And I started to show an interest in caring for these kids and really try to help them and, try to move the field on really wanting to embrace caring for these children.
I have a feeling most people have that view of pediatrics as dealing with, the wellness care, which is critically important, making sure you get your immunizations on time and dealing with all of the infections that all of our kids are exposed to. But we're not really thinking about those kids that really do have multiple or chronic medical conditions that really need that comprehensive care. And parents do struggle. I grew up as a child with multiple medical issues, and now I have 2 kids and I'm juggling their care. So having that expert to guide you in a way that you do and your team does is so important. So thank you for doing what you do.
Thank you very much.
Well, let's talk about the topic at hand. How do we define a child that has medical complexity?
We think of kids who have an underlying lifelong, life-limiting chronic health condition that usually is severe enough that it will affect multiple organ systems of the body and the functioning of those systems. So these conditions can affect the children's ability to breathe, to eat, to digest food, to walk and talk. And because of the seriousness of those functional impairments and the underlying condition, the kids have a lot of healthcare needs. They take a lot of medications. They rely on a lot of equipment at home, maybe oxygen or feeding tubes. Mobility aids, all kinds of stuff. And they're engaging the health system so much to have all those healthcare needs met. Yeah. And because we have specialists for every type of problem, these kids can have 20 plus healthcare team members trying to take care of them.
Yeah.
Medical, surgical specialists, therapists, home care providers, school-based providers. They often need a lot of surgeries. They also can become sick, and they need to come to the hospital or the emergency department. And so engaging the health system so much makes them the highest health resource utilizers of all pediatric populations. So those are the constructs that we think about when defining medical complexity in children.
As a neonatologist, for me, we send home many of our babies. They have lots of medical needs when they go home, and that's hard for parents to figure out how to manage. Folks like you that are really helping to coordinate that care becomes critical and life-saving, I imagine, for families.
It totally does.
So, Dr. Barry, how common is the population of children with medical complexities, and how does having a child with medical complexity impact families and the healthcare system?
We think the prevalence of these children is around maybe 2 to 4 per 1,000 children. It's pretty rare.
Yeah.
But to arrive at that, you're aggregating the prevalences of all these other rare conditions, right? Kind of carving out the population of kids that are really complex within cerebral palsy or spina bifida or other organ system-based problems, and then adding those kids up together to kind of get to that prevalence. But even though they're rare, the reason why we feel like they're everywhere, especially in our pediatric healthcare system, is because they're engaging the system so much. We just completed a study of inpatient care for kids with medical complexity, and they're accounting for about a fifth of all pediatric admissions on all hospitalized children for any reason throughout the United States. Right, so it's a huge impact these kids are having.
Well, and it makes sense, right? These are the kids that need it the most. Complex care services, we can actually give those kids the chance for, maximizing their future and optimizing their happiness, their quality of life. I am a beneficiary of complex medical care and couldn't be happier with the life that I have. So
fantastic.
It's so thank you to doctors like you that take care of kids like me. So let's talk a little bit about how Brian is feeling. He doesn't feel like he has someone overseeing the whole big picture. And I think that's a common problem. What do you hear from families who are trying to navigate their healthcare system, who have lots of medical needs?
So, we hear great things from them about engaging all their healthcare team members. And when they're one-on-one with them, thinking about the particular problem that clinician is an expert in caring for, they're great at assessing the organ system of their expertise. However, all these organ systems integrate with each other. And so if you're making a decision about treating one health problem, it could affect the others. Or if the child needs a surgery, for example, let's say they have a curvature of their spine like scoliosis, and they need an operation for that. Well, now that could affect their breathing, it could affect their heart, their musculoskeletal. There's so many things that could affect, and now you've got to think kind of across the board about how are we going to get that child ready for surgery? Are they healthy enough to undergo the surgery?
Are they? Yeah.
Should it be done?
Yeah. Complex questions.
How can we really set them up for success? We do think it's just better care for the overall family and their well-being when you have at least one person who's taking the time to dive in and understand every health problem, every medication, every piece of equipment, all related to past medical history, past admissions and surgeries and everything. And it takes time to do that. It's not easy.
No, it's not a quick visit. Now you're thinking about the whole picture and having to put all the pieces of that puzzle together to make sure you're making the best care decisions for that individual child.
It does take a lot of time.
It does.
And reviewing, just even chart reviewing.
Yeah.
These kids have terabytes worth of
information.
History.
Yeah, imaging, labs, notes.
And so you're trying to piece that story together and talk with the families and make sure you don't overlook anything. So even just that health information piece itself is challenging, but then you've got to assimilate all that and use your brain to arrive at some level of wisdom for making or recommending about a decision about whether to proceed with the surgery or not, or how to navigate through that.
You're reminding me of an experience when I was thinking about going into medicine. I shadowed an orthopedic surgeon, and he had a patient that had complex congenital heart disease, and they were worried about doing the surgery. I had watched the family meeting with the family and the child, and they had reviewed and talked to the cardiologist, but they weren't, they didn't really have someone putting that whole picture together. And I remember that young boy saying, because they said, this is going to be high risk. And he was like, I want to walk again. So yes, I want to have this surgery. This kid was probably, I think, 12 or so. He was brave. So ultimately they decided to move forward. I will tell you, sadly, that child died on the operating table, and I saw it all. And that was my first experience. This is important. We're making life and death decisions for kids, and they want the best quality of life. So you want to take that family-centered approach, bring it all together, but also know what is best. And unless we have someone like you to help coordinate that, sometimes we don't know.
Well, the kids can be so fragile.
Yes.
And they are at risk despite our best intentions.
Yeah.
So really thinking ahead of time and making families understand that risk, and really partnering with them to know that we're here with them regardless of what they decide. We're by their side, to try to get through these unfathomable circumstances
that no family should have to make.
Exactly.
Yeah.
Exactly.
And I don't think back then we had complex care pediatricians, so that wasn't even a thing. But we're thankful that it is now, because that's going to help more kids like the patient that I saw. So
I think so
great.
too.
So, Dr. Barry, when families either don't have access to someone like you, like, what does that care, navigating that care system look like for an individual parent?
It's a lot of work. Now, the parents are already spending hours a day with direct caregiving for their children at home.
That's right.
And so they're doing that and trying to be a mom and dad or sister, brother, sibling, right?
Yeah.
Other
and
kids in the
spouse.
home. And spouse. And work. And life. And then on top of that, we're going to ask them to come to 50 outpatient visits a year, once a week, and go to the local pharmacy, a few times a month for refills. And then the child gets sick a few times a year, so spends 20 days in the hospital. So you have all that. And then on top of that, we may ask the parents to be the care coordinator. So if the surgeon says, I think it's time to operate, then they're the ones reaching out to the entire team, asking the questions. And let me just tell you, we recommend things as providers all the time. And a lot of the times these things just don't get done.
Yes.
It's unreliable.
Yes.
And the families know it because we recommend it to them. And then they say, well, wait a minute. I thought we were going to get this new piece of medical.
How come we didn't get it?
It's not delivered.
It happens to me all the time with my kids. And then you got to call and figure that out.
Totally. And the wrong equipment is delivered to your home and you're dealing with the durable medical equipment vendor, or insurance says, we're not going to approve that piece of equipment, or it needs a new letter of medical necessity.
Don't even get me started on that stuff. So no matter what, you're going to have work to do.
It's too much.
Yeah. How does social determinants of health impact, this particular population?
We know through some national studies that their families are more at risk for experiencing social and familial challenges. A lot of that sparks from the hefty caregiving that these families are providing, and the limitations that places on them living their lives.
Yeah.
But we have families that they have to stop work. Relatedly, they may experience financial challenges.
Yeah.
Some are living in poverty for multiple reasons. Housing challenges, food insecurity, spousal relationships that may not last. I mean, there's so many things that our families are going through. And so many tell us, I'm doing all that I can, but because of these other challenges, like I can't move the dial anymore, for helping our kids. There's such a greater awareness now, I think, of that intersection of social and medical complexity. And we're seeing nationally, a bigger push for social work and screening, philanthropic programs that are putting dollars into families' pockets to help them.
Yeah.
One is called Little Sparks, which is a new one that's been developed locally here, which is absolutely fantastic, but they're providing families with direct deposit of funds to underwrite the challenges that they're having. That's sort of the next frontier, is how do we help families overcome such challenges, and it'll open up their health as well as their child's health. And I believe these families have the right to much better care. So that's an impetus for us to try to take a lot of that effort from the families, and put it on our shoulders, because that's our job.
What does the right care look like, and how does it work?
This complex care model, it's a philosophy. The care needs to be managed by one person who's really taking a holistic, comprehensive, deep dive view to understand everything about that child's health.
You need a captain of the ship.
You need a captain of the ship, for sure. All right. The second is, and it can be that person or a different person. There can be multiple people involved in this, right? But someone really needs to manage and integrate the healthcare team members that are taking care of a particular child. If there are 20 people involved, someone needs to have the lens on what are the roles and responsibilities for all these team members. Is there anything uncovered? I can't tell you how many times we've had a child, for example, with some malnutrition. And we all think, oh, well, the gastroenterology team is taking care of the malnutrition. So you ask them, they say, oh, we thought it was the metabolism team.
And it's just getting missed.
It's just getting missed. I mean, you can have very simple, straightforward conversations. Who's doing what? Is it all being covered? And rallying and pulling that team together when needed for major medical decisions, things that are happening to support the child and family.
The cruise director. I'm coming up with analogies.
All right, we got you're the captain and the cruise director.
Yep, you gotta.
All right, the third, you need someone who's on top of the reliability of the care. Now, you imagine if there are 20 providers on a child's team, everybody's recommending a few things to be done in between their office visits. Now we have 60 items to keep up with. Someone who's proactively managing, like what needs to be done and when.
And you have to help prioritize, right, for families. Because the subspecialist is not likely to do that because, they're focused on their part of the puzzle. I feel like that's like the Army captain or something.
I like it. Yes.
We do this first. This is like life-saving. Then
Very
we'll go
disciplined,
on to
very regimented,
yes,
right? Just keeping track of it all.
Mission 1, mission 2.
I like that.
Oh, these are such important roles, though.
And there are more.
I'm ready. I'm learning.
All right. So the fourth is that the care has to be set up in a way to rapidly respond to the children and their families when they have an urgent need.
Okay.
So
now you're talking about the paramedic on the team.
It's like a paramedic.
Being ready.
Right, being ready. But that could be in primary care. It could be a specialist who stands up and helps. The family members are so amazing at having that extra sense that something is about to go wrong. Their
they know their child.
Spidey sense. They know their child. They're just not looking. Their color is changing. They're not acting the right way. They'll do this sometimes when they end up having a seizure exacerbation or something, right?
Yep.
Having someone that's going to pay attention to the families and say, okay, we're going to get on top of this right now before whatever is developing is going to be severe enough for you to come into the hospital, need to go to the emergency department, right? You really want to have that rapid response with the family. And that means being available to talk to them and having the time to navigate through it because it's not quick.
No one wants to go to the ER if
No
you can
one wants to
avoid
go to
it.
the ER. That's right.
Yeah.
That's right. And the fifth and final component is achieving some type of proactive wisdom to look into the future of what problems and challenges may arise for them and to make plans to try to prevent that from happening altogether.
Yep.
Or mitigating the severity of whatever that might be, or helping the family achieve a goal.
Yes.
We may have a family that says, we really want to drive across country to Uncle Joe's, 80th birthday party in Seattle with a child who has a trach and a vent and all kinds of stuff. But the family wants to go. It's 6 months from now. All right, well, let's put it all together.
Yeah, let's prepare.
Let's prepare. And we know in the coming year that my child is likely to have an aspiration pneumonia or two. They always get one in October. How do we plan for that and not just be surprised when it happens again?
Either prevent it or have a contingency plan where they're going to get the resources that they need should that arise.
That's right.
Wow, that's a lot of really cognitive overload, I would imagine, for families. And now I'm thinking about you as the complex care physician, that's also a lot to navigate. But it's making a big difference for families. Huge.
I think it's making a difference. And I'll say, too, operationalizing all that is not easy.
I'm sure not.
And that's where we so much appreciate the support of our General Pediatrics Division, the Department of Pediatrics and Surgery, the whole hospital, embracing the care for these kids and saying, maybe we need longer outpatient office visits because they're taking more time.
Yeah.
Right?
Coordinating all the care and helping prepare for all of these different things that you were talking about. That doesn't always happen just in the office. That happens when the patient's not in the office, but you're probably on the phone and talking to other specialists, like you said, coordinating that complex care.
That's totally right. I'm so grateful to see the emergence of complex care programs across the U.S. and beyond. Like you were saying earlier, this just wasn't in place 20, 30 years ago.
No. Do you happen to know how many children's hospitals have complex care programs?
We have a survey that we're wrapping up now. We think that there are around 90 programs.
90 programs, that's
throughout
great.
the world.
Wow.
And most
feels
children's
like we need
hospitals.
more, though.
I think that's right.
When you said the whole world, I was like, oh, wait a second.
Right. But that number is
that's great.
way greater than it was prior.
because I don't think I had ever heard of it when I was younger, or even in training.
That's right.
For that matter. The fact that you were talking about like how complex care pediatricians are helping families to prepare for the things that they want to do. It can't just be all about the medical care. We need to remember this is a family who has, goals and interests, and just like other families, the kids want to be engaged in other activities, as school and extracurriculars. Can you tell me a little bit about how do you maintain that focus for our patients in this population?
I think as providers, we get lost in the weeds of all the medicalness of taking care of these kids. When you're kind of in that world of how can I tweak all these things that's really going to have an impact on the child's health.
Yeah.
But you have to elevate out of that. I mean, there have been multiple times when families have told me, Jay, can we just stop talking about some of the medical stuff for a minute? Our goals for this year, I talked about the Uncle Joe, and his birthday party, but there can be other things.
Yeah.
Their child wants to ride a horse for the first time. How do we do that? And when you have a tangible goal like that in mind, and a family charges you to say, hey, can you help us get there? And you see the bigger picture of their well-being, the child's well-being. And that also can help motivate the entire team.
Yeah.
You've got a common shared goal now, to work on.
Well, and it's like all the medical care is critical, but the reason we want it to be so good is so that we can give kids the opportunities to do the things that they want to do. It's a little different than adults, right? Where we can say, okay, let's just focus on the medical. Maybe I'm biased, but with kids, the goal is to help them be a kid, to live their best life. And otherwise, what are we doing? We got to give these kids a chance to do all the things that they want to do.
Totally right. The medical care is a means to an end.
Yeah.
And that end should be defined with every child and family individually of what they want.
Yes.
And we should help them get there.
So I love about kids, they have their own goals in mind, and so it's just our job to kind of keep up.
Totally right.
Well, speaking about that medical side of things, I want to also clarify a medical home. Is that sort of the same idea as complex care services?
It absolutely is in the same space.
Okay.
That kind of 5-point philosophy that we talked about, how that can be implemented and executed can be in several different ways. And a primary care medical home is certainly a fantastic place for that to happen.
Okay.
But there are other ways to practice complex care. Some programs are offering those pillars and are not called complex care at all.
Yeah, they don't have the name, yeah.
To me, it doesn't matter as much about where or how.
What you call it?
What you call it. It's just that the families get it.
It takes a village, right? In this population, you need a medical village, too, to help you raise your kid.
That's right.
Okay. It all makes sense, that holistic care approach, because a lot of our patients have things sort of like school barriers, right? Just, getting accommodations that they need to be able to access resources in an equitable way, because it looks different for even different kids and different populations. And that's not something that we as physicians or clinicians are necessarily trained on, right? It really does take that multidisciplinary approach. So having your social work, your psychologist, your nutritionist, in addition to all the medical subspecialties, we can't provide that holistic care without everybody on the team.
That's exactly right. And you mentioned school, which is so important on multiple levels for the kids.
That's their number one job, right?
Right,
to
for
learn.
their exposures and learning and the environment and all that comes along with that. And thinking about a child with a ventilator going to school or who needs 20 medications administered throughout the day, or to leave class for some therapies and come back, working with the schools to make that happen. But also going to school also gives the families a break.
Yes, it's important for them.
Right?
Yes.
Trying to give families, some time for their rest and their well-being out of this, to rejuvenate.
If we don't take care of ourselves, we can't take care of others. So I think that's important for everyone.
Well said.
Yeah. Well, this has been so great. I'm learning so much about complex care. Can you tell us a little bit about how that works here?
Sure. So our complex care program started about 40 years ago by one pediatrician who decided that she wanted to exclusively take care of patients within general pediatrics and developmental medicine who had complex medical problems.
Oh, amazing.
All right. That was a long time ago, 1980s. Over time, she started to build her practice, and there was fantastic support from the division, the department, the hospital. She started integrating with the surgeons for shared patients.
Huh.
And then other people said, I want to be like her. Her name was Mary Lynn Haney.
Oh.
All right. And so all of a sudden, another pediatrician steps in. And then a nurse says, I want to do this. And all of a sudden, you start to have a little team. Fast forward now, many decades, but I wanted to acknowledge how it all started because it's so important.
Amazing. She had a vision.
She had a vision. So now we follow over 5,000 kids across these different programs.
Okay.
Umbrellaed within our complex care program. So we have a primary care medical home. We call that our Rainbow and our CASA programs.
Okay.
That's out of our primary care center in Martha Elliott. Children get all of that coordinated care and comprehensive care and all the well-child stuff.
So they don't need to have a pediatrician and their complex care pediatrician. They just come to complex care.
You just get one.
That's great.
It's fantastic. But for families that want to keep their pediatrician in the community, you can have a consultative complex care pediatrician, and we call that our complex care service.
That makes sense because I imagine some families might live farther away, but they can still get your support and services by partnering with their pediatrician that's local that can manage a lot of the more, frequent things. That's great.
That's totally right. Boston Children's has such a draw of complex patients that are coming. So about a quarter of all of our patients live out of state, out of region, even internationally.
It's incredible that you are able to provide services like that so that, you really reach so many kids.
That's right. Now in the outpatient setting, we have complex care pediatricians embedded into multidisciplinary centers throughout the hospital, which we love.
That's great.
We're in clinic with the other medical and surgical specialists, all seeing the patients, coordinated, making shared decision-making in real time. We absolutely love being a part of those programs.
We also have an inpatient component, correct? Can you tell me a little bit about how that works?
So back in the day, pediatricians, even within the complex care program, if one of their patients was sick, they would admit them themselves to the hospital, right? And follow them.
We stuck with our patient, yes.
Ubiquitous.
Yes.
But with the involvement of hospital medicine, that changed a little bit.
Yeah. And hospital medicine is all over, and adults, kids, because you become a hospitalist and you become very good at hospital medicine, which is different than ambulatory medicine.
That's right. That's right. However, for these kids, when they're hospitalized, there's so much history that you have to take into account that sometimes it's really helpful to have a hospitalist with the lens of sort of that complex care who's really integrated with the outpatient team, communicating, getting them involved about how to get them home in a safe way. So we have 2 dedicated inpatient hospitalist teams within our pediatric hospital medicine program.
Fantastic.
That are dedicated to kids with complexity.
So there's still that continuity and that expertise of complex care, but then you also have those that are really focused on, what patients need when they're hospitalized versus ambulatory, and then there's good communication.
Right on.
Why isn't all of medicine like this?
That's right. We do have 2 other programs that we're trying to evolve more, but one is a home-based program.
Okay.
And there's so many other home-based programs throughout Children's which are wonderful. We're trying to learn from them about how to do more of that because it's so convenient for the families. We learn so much about being in their homes. They appreciate us being there. And often you can have more substantive conversations, with families around the dinner table.
Yes.
Or in their living room about big ticket things about their children.
And plus you get to see them in their environment and help address the issues that they may be having in their home environment. In my simulation hat, we train a lot of our parents. We try to have them practice before they go home for the first time, with a ventilator and a G-tube and a suction and an oxygen and all of their equipment. Set up the room how you think you are going to set up your room at home. Do the best you can. And then let's play around and see in different care scenarios, does that work? And then you find them making changes iteratively. And of course, it's in simulation, so it's a safe way to do it. It's before, they're home with their child. They're practicing on a mannequin in an emergency or something, and they're able to figure out, it would be much better if I had the suction on here with the oxygen and I can reach everything. Simple stuff, but it matters. Home-based programs just make so much more sense.
Agree.
And it's kind of going back to how we delivered care, right? Back in the
days. That's how it all started.
Yes.
Right.
So that's fantastic. And it's probably much easier for families too.
Now, I will say the last frontier for us is getting more into the family wellness space, thinking about respite, what can we do as a service that could provide direct help to support the families, to let them know that we care about them.
Yes.
And it's just as important to think about those things as it is their child's health.
Yeah, they all interplay, right? We were talking earlier, you have to help the families stay stay well and healthy and, rested so that they can provide care. Some of these therapies too are really impactful for kids, right? You think about things like yoga for kids who have medical conditions. It can be majorly impactful in a positive way, helping them heal or just helping them feel good and maximize their health and well-being. It's important.
Very important.
Holistic care. I love it. Wow. So we do a lot through our complex care system. What types of patients is the program suited for? Like how do families access care here?
Our enrollment criteria are that the children need to have a lifelong, life-limiting chronic condition.
Okay.
That's severe enough that it affects at least 3 of their body systems, the functioning of those systems, and a significant dependence on medical technology in some way.
Okay.
We follow a lot of kids who have breathing tubes, tracheostomy, and gastrostomy feeding tubes.
Yeah.
And then the last criteria is that the children and families are just not getting what they need out of the existing healthcare system and team. If the members of their healthcare team are doing a great job, then we absolutely love that.
Yeah.
And we don't want to put ourselves out of business. But
I don't know that we're going to get rid of complex care anytime soon,
Right.
Dr. Barry.
Right.
There's a huge need. That's the thing.
That's right.
Because I think healthcare is getting so much more specialized and everyone's got their area of focus, which provides great care for things that maybe we didn't know how to care for before. Yet you create all these silos and you got to break down those silos and have someone putting it all together.
Families can utilize our service at different levels of engagement with Boston Children's.
Oh.
Right. You don't have to have all of your care exclusive at Boston Children's to see us.
That's true, because you can be a partner.
You can be a partner. I mean, we have a lot of kids that I said before are living in other states. They may come in for a particular surgery and we will handle their perioperative care and get them home and they're back in their home environments. We're open for being helpful in any way.
So we've talked all about sort of what complex care services look like here and in general for our kids. I think another important part of providing complex care is advocacy. How do you and your team advocate for kids?
So I'll have to say our lived experience partners, our families within our programs have been fantastic at teaching us how to advocate.
That's awesome.
They are talking the talk and walking the walk.
Yep.
So we have strong partnerships with some national family advocacy organizations. One is called Family Voices.
Yep.
They're in every state.
That's fantastic.
And so we're starting to partner with them more in our research studies, our advocacy studies.
Great.
And we have strong partnerships with them in a national health systems and policy research network.
Very cool.
That we've put together. So we're learning a lot from them. And even locally, we've had some parents from Children's who have advocated for the kids. They have literally helped write and pass legislation to increase payment for home nurses. You know, there's a shortage of pediatric home nurses.
Yes. Very big shortage.
A very big shortage. So our families have advocated to create a new type of home care role called a complex care assistant, recognized by the state that it's not quite a nurse in terms of training and background, but this type of a person can be trained to give medications, to do some tracheostomy care or G-tube care at home, things that the families with no training are experts in doing, on their own child, are doing.
That's amazing.
So that's been phenomenal. We've also had families help us advocate on the federal level in strong partnership with the Children's Hospital Association, advocating for all care across all U.S. children's hospitals. But they've taken up children with medical complexity as a prioritized population because they know how important children's hospitals are to serving these children. So a few years ago, they worked with families and the government relations teams from the children's hospitals to pass federal legislation for some Medicaid reform to help with payment for these children.
Are you talking about the ACE Kids Act?
It's the ACE Kids Act.
Do you know I got to go help
Were you in
advocate?
that?
Yes. It's reminding me of such great memories when I was national ambassador for Speak Now for Kids.
Oh, yeah.
And I got to go to Capitol Hill and announce the bill. And I'm like, what am I doing here? It was so great, though. And then my kids start coming up in the middle of the press conference.
Oh, that's
and
wonderful.
I'm like, but it was for kids. So, everyone just loved it and laughed. And it was a lot of fun. Yes. So I am very familiar with the ACE Kids Act. And I'm so glad that it passed because it allowed kids to cross state lines to get the specialty care that they needed. Right. And that was before COVID and you had even any telehealth options for anything, right? And so, the kids were not getting good care if they didn't have access to a children's hospital with that expertise. And for kids with rare diseases or medical complexities, it's critical. It's life-saving.
That's so fantastic you were part of that.
I know.
Keeping that awareness, keeping them on the radar of everyone is important.
That's really important. Thank you. So as we near the end now, is there anything on the horizon from a research perspective that you'd like our audience to be aware of?
We've done so much national work
Okay.
showing impact and outcomes for these children. But, so much of the care is on a state and local level. And so many of the children rely on Medicaid for access to care. We now have fantastic data for Medicaid across all U.S. states, and we're starting to put together some analyses that will help states understand how many kids with complexity live within my state.
Yeah, if you don't know, how do you know if you're able to serve their needs?
Exactly.
Wow.
What health conditions do they have?
Yeah.
How often are they hospitalized? How often do they go to the emergency? How many different providers and hospitals do they use? How many have home nursing? Wow. Just trying to get a landscape of who they are. And then how does my state compare with all states? Is there sort of a best in breed of a state that's kind of pushing innovations, that may help the kids that other states can learn from? So there's a whole body of work out there that we want to conduct in that space.
Yeah, I always say data is powerful because that's when you really know where you stand and where the gaps are so that you can ultimately improve things. And a lot of our patients rely on Medicaid, so I'm glad to hear that there's a lot of work going on in that area. It's going to be really important. Well, before we wrap up, Dr. Berry, is there anything that we haven't talked about that you want to make sure our listeners learn about complex care services?
Well, I will say this. We talked about the case earlier of an outcome with a child, in the operating room. And we want to continue to push on all of our analytics and data that we have to bring to bear to give families, a trajectory, a likelihood of if they're going to experience a surgery or other types of treatments, what's the likelihood that it's going to work or not work. So I see a whole movement of artificial intelligence, a bunch of great data coming together. I really hope this has a lot of promise for making us better, not just our clinical intuition, but trying to put some evidence behind it that we can share with families that will help them navigate through these really challenging decisions that they have to make.
That's so important. Yeah, to give families that those tools and what to expect too would be really helpful. And if we have more of the natural history and the data, we can make really good, share good information, solid information about what that looks like, what it could look like for their child.
That's right.
Well, this is the part of the podcast where we really love to give families a takeaway that they can use to help them raise healthy, happy kids. What are your doctor's orders today?
Okay. Order number one for families is to really think about the goals that you have for your family and your child. And don't be afraid to share them with your healthcare team. All right? Have discussions about and during a visit, I want to talk about the goals that I want to have for my child and family.
Oh, that's really empowering. Really empowering, because I think we're afraid to as parents. You don't want to bother anyone. Okay, so don't be afraid. Share your goals.
But then know, families, that you have the right to demand really good, comprehensive, coordinated, thoughtful, proactive, integrated care, for your kids.
Yes.
Know that can be a standard. And you don't have to accept anything less.
I love that. Kind of reminds me of being a mama bear a little bit, and parents are usually really good at that, right? Like
that's right.
So we got to put that to work for our kids in the healthcare system too. Thank you so much, Dr. Berry, for sharing all your time with us today. It's been great.
Thanks for having me.
Thank you so much for joining us today, and special thanks to our guest expert, Dr. Jay Berry, and our guest parent, Brian. Take care and be well.